Hi, my name is Sheila Mattley. This is my informative speech on the use of nasogastric and orogastric tubes in the NICU. This is for my Communication 1321 Business and Professional Speech class. In our NICU, we use nasogastric and orogastric tubes for different reasons. One reason is for feeding tubes, like this one. Another reason is for a pop-off tube, this one. And then for decompression, this one. Okay, so the sizes, there's different sizes for the feeding tubes. There's a size 4, size 5, and a size 6. You would use a size 4 or 5 for an NG tube, and a size 6 for an OG tube. And then the Anderson is for decompression. And it's a size 10 French. You can either have gavage feeding or continuous feeding. If it's gavage feeding, you do gavage feeds over about 30 minutes and every 3 to 4 hours. Okay. So to insert a nasogastric or an orogastric tube, you first do your hand hygiene, and then you measure from your nose for an NG tube to your ear, and then to your middle of your xiphoid process and your umbilical, your belly button. For an OG tube, you measure from your mouth in the same route. Once you have it in place, you secure it with tape. If it's an NG tube, you put Duoderm down and you tape it off to the side, like this, I guess. And then if it's an OG tube, you tape it right in between your lip and your mouth. Once it's in, you tape it down to secure it. And then to check placement, you insert air and listen with over your stomach, or you can pull back with a 10 cc syringe to get gastric content. Once it's in place and it's in the right placement, you have to label your tube with the time, the date, the size it is, and how far in it is. You have to change the tubing every 30 days to decrease the risk of infection, and also while you're using the tubes, you have to wear your gloves and do hand hygiene. You have to change the extension tubing from the end of the tube to the pump every 3 hours for gavage feeds, and every 4 hours for continuous feeds. You can also give PO or oral meds through your tube if they do not take a bottle. And then also at the end of each feed, you have to put 0.5 cc's of air to clear your tube so that you don't get bacteria built up in your tubes. For my research, I used Taylor Clinical Skills Nursing. I used the Mosby's online, and I used the UTMB policies for all my research. Thank you.